When a common infection sets in, it makes it harder for a son to breathe. The doctor at urgent care called an ambulance. That was more than a year ago. That family is still fighting a bill for the ride.
Jenna Sachs with why patients in other states don't have this problem in this Context 6 report.
I love your octopus costume, buddy. You look good.
For the parents of one-year-old Simon, the biggest scare of Halloween 2023 was a case of croup.
Urgent care was like, it's a breathing thing. You need to go to the emergency room.
At Aurora Medical Center of Sheboygan County, staff arranged an ambulance ride for Simon to Children's Hospital.
They had spoken to a doctor at Children's. Everyone was in agreement that he should be transferred.
Children's discharged Simon the next day, but weeks later,
oh my gosh,
came a second scare.
This doesn't even make any sense to me.
This time, a bill for the ambulance ride.
I looked at it and thought, I mean, this is crazy, but we'll have it go through insurance and see what happens.
Before insurance, the 58-mile ride cost Ryan and Sarah Nelson more than $10,000. After insurance,
$6,921.66.
That's despite the bill being run through 2 insurance plans.
We were in a unique situation where I had some insurance carryover from a previous job.
In January 2022, the No Surprises Act brought sweeping consumer safeguards to medical billing, protecting people in medical emergencies from out-of-network balance bills.
You shouldn't have to, in that moment, wonder, am I going to be able to afford this care?
Ground ambulance rides are a notable exception to the law.
I've written all of our state and national representatives to question why that's the case.
In August, Indiana's governor signed legislation to stop Hoosiers from getting surprise ambulance bills. The law requires insurance companies reimburse for ambulance services at a rate up to 400% of what Medicare pays.
We have been working as a consumer advocacy organization to stop these surprise bills.
The Public Interest Research Group, or PIRG, says Indiana is among 18 states to pass laws providing ground ambulance billing protections. Wisconsin is not one of them.
The problem is growing because these bills are getting larger and larger.
We kind of just feel a little bit stuck because these things do happen.
The Nelsons aren't the first to write to Contact 6 about surprise ambulance bills.
I just feel like this bill is outrageous.
So did Christine Kaliva last year and Michael James.
Not disputing the service, disputing the outlying cost.
But Kaliva, James, and the Nelsons all single out one provider, Superior Ambulance, for overcharging.
This is like an astronomical amount.
Simon's ride was classified as SCT, or Specialty Care Transport, the highest level of care. In 2023, Contact 6 solicited base rates for SCT from Wisconsin ambulance providers. All were below $2,500. The base rate for Simon, Christine, and Michael's rides from Superior, $6,600.
I can't speak to charges for other ambulance providers.
Kim Godden of Superior Air and Ground Ambulance Service of Wisconsin says their charge reflects overhead costs, medicine, technology, and Superior's response times for interfacility transit.
What's unfortunate is not the size of the bill. It's unfortunate that the insurance company didn't cover the bill and the patient received the balance.
The Better Business Bureau has 150 complaints about Superior Ambulance in 3 years. It warns consumers about a pattern of complaints alleging high or excessive fees.
We are not in the business of chasing bills.
Godden says they support states passing legislation like Indiana's. As for the Nelsons,
we don't have this kind of money on hand to pay this.
Superior isn't reducing their charge. Instead, it paused the family's bill to appeal to the insurance companies. The Nelsons feel Superior has already been paid enough.
I'm not against, paying a medical bill, but this is just obscene and unreasonable.
Aurora Healthcare sent us a statement saying patient safety is their highest priority, so they contract with providers who offer advanced training and special equipment. Aurora says it's not involved in ambulance pricing or billing. I'm Jenna Sachs, Contact 6.